इसमें अलग क्या है?
कोल्ड स्टोरेज डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
एक्चुअली इनको डायबिटीज है। नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Good morning, Apollo family. Did you know that women are 40% more likely to suffer from insomnia than men? Well, reasons and pattern might differ, but it is very important to reach out to help and take treatment at the right time. Because sleeplessness might not be as tabooed as depression, but if you ignore sleeplessness for a while, it might lead to depression. This week on Apollo 24/7's Health Hour, we have invited Apollo's expert senior consultant neurologist Dr Navdeep Kumar to this live session. Join us 11 a.m. and ask all your questions about sleeplessness and also win prizes from Apollo 24/7. See you there.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and good morning. This Sunday we are bringing you Health Hour, where secrets to good sleep are going to be shared. It's an interesting topic. We are going to invite Dr. Navdeep Kumar, a senior neurologist at Apollo Hospitals Noida, very soon onto the show. So get ready, folks. It's important to sleep well. And I see that a lot of people have typed in their questions, pre-registered questions. Everybody is asking about good sleep or lack of sleep. What can they do about their quality of sleep? It is very important to address this question, and we are giving you an opportunity of meeting an expert from Apollo Hospitals every week and ask your queries here in this live session. Today we're going to take your questions up in this live session very shortly once the doctor joins. Dr. Navdeep will be joining us very shortly. So you get ready with your questions. I see Mr. Murthy, Akshit, Sangeeta Haq, Anil Kumar, Nikita Rawat, Manju, Alka Khanna, Vetri Raju, John Rajapandian, all of you, Babu Malik, all of you, your questions will be taken up on the show very shortly. So before I start the show, let me remind you that downloading Apollo 24/7 is equal to getting services from entire Apollo Hospital. It brings you everything together into your palm. Control is in your hands right now. So do go ahead, download Apollo 24/7 app. And also if you have the app on hand, you can use the discount vouchers and coupons that we're going to share towards the end of the show on the app. And also there's a health quiz coming up. You can win prizes from Apollo 24/7 as well. Keep watching the show. Towards the end, I'm going to share some discount coupons. Let me start the show by talking about this wonderful initiative, which is called SACHI in short, Saving a Child's Health Initiative, which is free pediatric consults for every child in need. SACHI, in association with Apollo 24/7, is on a mission to make quality healthcare accessible to underprivileged children at no cost. This is a program which is going to benefit children across India. If they're underprivileged and are in lack of access to good healthcare, then top pediatricians who are renowned Apollo pediatricians, more than 10 plus pediatric specialties are available here in this program. Scan the QR code which is there on the screen to know more about the wonderful program and share the good word too. चलिए आज का डिस्कशन शुरू करते हैं. What are the secrets to good sleep? And insomnia क्या होता है, किसके वजह से होता है? How can you take care of your quality sleep? We're going to talk about everything. We have invited Dr. Navdeep Kumar. He's going to join us now. He's a senior neurologist at Apollo Hospitals Noida, and his experience ranges about 13 years, and professional memberships हैं उनके Indian Academy of Neurology, Movement Disorder Society of International, Movement Disorder Society of India, Principal Investigator in Pan-India Registry of Progressive Supranuclear Palsy, and life member of IMA Noida. He specializes in botulinum toxin injections in various movement disorders, deep brain stimulation in Parkinson's patients, and he is a gold medalist in MD medicine, and his research papers are in stroke in young patients, Indian data, and diabetic neuropathy as well. Good morning, Dr. Navdeep Kumar ji. Welcome to the show.
Good morning, madam. Thank you so much for the lovely introduction.
Thank you, doctor. People like you who have the experience and expertise of handling issues and range of disorders, you joining us this Sunday morning on Health Hour for our viewers, it's a great privilege from our side. Thank you so much, doctor. So,
thank you so much, madam.
Let me start with this. आप कैसे जीते हो, आपका दिन कैसे गुजरता है, that is one part, but आप कैसे सोते हो, that is going to dictate what you are in the next day. So if I'm not able to sleep well, I understand that it's going to affect me. So what can be called as insomnia or sleeplessness? पहले आप हमें वो बता दीजिए.
This is one of the most common problems seen by any sleep neurologist nowadays. Insomnia basically is difficulty in falling asleep. So if you're not able to fall asleep for 1 or 2 nights, we don't call it insomnia. Insomnia is that if you have difficulty in falling asleep at least 3 nights in a week for 3 months, so that is insomnia. Insomnia is divided into primarily 2 parts. One is primary insomnia, other is secondary insomnia. The secondary insomnia is whenever there is an underlying medical condition or any other neurological condition, orthopedic condition because of which you are not able to fall asleep. And if there is no disease that can explain the difficulty in falling asleep, is primary insomnia.
ठीक है, so I understand that एक दिन नहीं सोती हूँ तो insomnia नहीं होता है, but then continuously the mantra is can you please repeat that? 3 hours? Sorry?
3 nights in a week. You have difficulty in falling asleep for 3 nights in a week for 3 consecutive months.
So that is what is called insomnia. And that's when one has to, even before that, one has to realize that they're creating a pattern and then reach out to help. So, as you were talking about the reasons, doctor, you were also saying that physiological reasons or any disease also can lead to insomnia. एंड इतना टैबू है कि हम हमारे इसमें वी थिंक दैट इंसोम्निया इज अ मेंटल इलनेस और मेंटल डिसऑर्डर एज वेल. तो कौन सा साइकोलॉजिकल साइकियाट्रिक परव्यू में आता है एंड कौन सा फिजियोलॉजिकल न्यूरोलॉजिकल और लाइफस्टाइल कंडीशंस में आता है? इज देयर अ चेंज बिटवीन ऑल ऑफ दीज डिफरेंस?
See, basically, preferably, you need to consult a neurologist for difficulty in falling asleep. Sleep in itself is a subject. So there are different types of sleep related disorders. So REM sleep behavior disorders, NREM related disorders. Then so these are best usually managed by neurologists. So in case if you have any sleep related issues, the best person is a neurologist that you should consult. So it's for the neurologist to decide basically. Then
Right, because lot of issues where we don't even know who to consult. हमें पता है कि हम हमारे स्लीप डिस्टर्बेंसेस है, किन से बात करें, या अगर स्पेशलिस्ट की ज़रूरत पड़े तो किन से कंसल्ट करें, ये इनकी डाउट लगी रहती है हमेशा. थैंक यू सो मच फॉर क्लियरिंग दैट आउट फर्स्ट. सो इम्पैक्ट ऑफ नॉट स्लीपिंग वेल, वी अंडरस्टैंड दैट डे खराब होता है, बट लॉन्ग रन इश्यूज क्या होते हैं? व्हाट आर द सीरियस इम्प्लीकेशंस ऑफ इंसोम्निया?
So, if you are not able to fall asleep properly, you don't have a comfortable sleep at night. Obviously, you are not active. You don't get up fresh in the morning. So, दिन की शुरुआत अगर अच्छी नहीं है तो it's not good. Then you have difficulty in concentration. You're not able to do your best. Then if you haven't slept comfortably, then you develop headache. You develop altered eating patterns, irritability, frustration, depression. All these things, they eventually develop if you're not able to have a comfortable sleep at night.
Right. So I know that a lot of people are asking me to speak in the language that my vernacular language. Unfortunately, Telugu audience అందరికి ఏంటంటే ఇది దేశవ్యాప్తంగా చూస్తున్న షో కాబట్టి I will not be able to speak in Telugu, and because we are reaching out to a larger population across the country, we will predominantly keep this in English and here and there Hindi as well. Thank you for Mr. Shivraman and others who are asking this. So, Doctor, I am going to take up questions from the audience. Audience, for your knowledge, for your understanding, please type your questions only on YouTube chat box. Even if you're watching this on Apollo's Facebook page or my Facebook page, please do, or Doctor's Facebook, wherever that you're watching this, please ask your questions only in the YouTube chat box, where we can take your questions up to Dr. Navdeep Kumar. So, majority of people are asking कि क्या क्वालिटी स्लीप होता है? मुझे साउंड स्लीप नहीं होता है या क्वालिटी स्लीप नहीं हो रहा है. आई एम नॉट एबल टू स्लीप फॉर मोर देन 6 hours. So what is a good time of sleep? How much sleep does one need, doctor?
So average adult, the sleep duration is 6 to 9 hours. Some people, they don't feel comfortable if they sleep for 6 to 7 hours. They need 8 to 9 hours of sleep. So 6 to 9 is a normal adult. And pediatric population and infants, children when they are born, so it's around 20-22 hours in the first month of their life. So as we grow, the duration of sleep, it reduces. Many patients, they come to me and they say, doctor, I take good 8 hours sleep, but still I'm not comfortable. So when we ask them, the timings are they sleep at 1 o'clock at night, 2 o'clock at night, then they are getting up at 10 o'clock in the morning or 11 o'clock in the morning. So there are broadly, I can say there are 2 types of sleep hormones. One group is the wake hormones, other is the sleep hormones. Sorry for this. So the secretion of sleep hormones, it begins at around 10 o'clock at night. So between 10 to 11 is the sleep switch, and around 6 o'clock in the morning is the reversal of the switch. So you might have noticed that if we get up at around 6 o'clock in the morning and we sleep around 10 or 11, there's a different kind of freshness with which we get up in the morning that we don't get if we sleep late or if we get up late or if we get up too early. So this is the biological reason for that. So duration of sleep as well as the timing of sleep, both are important.
Right. So here I can see Manju who's asking, are there any foods which help you to sleep better or uninterrupted? All right, that's a very important question. Doctor, I think there's a power cut towards your end. No problem. I can. Yeah. There's no. Yes, it's back. All right. We can. Can we just check your audio, doctor? Can you hear me?
Yeah. I'm audible?
Yes. Yes, doctor. Yes. So, Dr. Manju is asking, are there any foods which help to sleep better or uninterrupted? And also, Mr. SSR Murthy, who is asking, what's the best dinner for good uninterrupted sleep? Is food related to sleep, doctor?
It's not primarily related to sleep. If you have a good, healthy, full stomach, obviously you have a comfortable sleep. So usually, what we say might be unrelated slightly to this topic. Patients ask me good time to exercise. So it's very common. Patients, they say that we come back home, we have our dinner, and then we go for a walk. So after a meal, after any major meal, almost 10 to 15% of blood is diverted from the muscles, the skeletal system, to the GI system for proper digestion of food. And if you take a heavy meal, obviously there is more diversion of blood towards the GI, even from the brain, from the muscles, other parts of the body. So if you are overeaten, you feel sleepy. If you have not eaten properly, if you're not full, so you don't fall asleep. Adequate diet is important.
Okay.
There is nothing specific related in diet which helps you in having a proper sleep.
Okay.
Sleep
Sangeeta
in
is asking, sorry, Sangeeta Haq is asking, what's the optimal difference in between dinner and sleep time? बोले तो कितना दूर रहना चाहिए? What is the time that I need to maintain before I sleep? And can I exercise in between the dinner and sleep time? You were talking about it a little earlier.
Yeah, just now I answered it. So after your meal, you should not exercise, and there is no recommendation, but it's like 1 to 2 hours after your meal you should fall asleep. So ideally you should have your dinner. Ideally is around 8ish, so that by 10:30, 11 you fall asleep.
Okay, that's nice. So now there are certain घर के नुस्खे where people try कि दूध पी लो नींद आ जाएगी, apple खा लो नींद आ जाएगी. Do you endorse anything of that sort, or are these?
No,
No. Okay.
no.
Okay, doctor. So
It's whatever.
good food.
Um, um, every person is different. Every patient is different. So if a person is in a habit of having a glass of milk before going to sleep, so let him have that glass of milk. If you don't give that milk to the person, he wouldn't have difficulty in falling asleep. So there is no harm in stopping it. And it's not like if you have a glass of milk, you'll have a comfortable sleep. There are no recommendations like that.
All right. So that is with food and sleep. Also, can I add one of my questions? Are there
Yeah.
any kinds of foods that you should avoid to which are hindrance to sleep? See, there are nothing that can help you to sleep, but these spicy or acidic or foods that can be heavy.
See, spicy food obviously would lead to gastritis if you are taking it for a longer time. Then, if you have gastritis, you definitely will have difficulty in falling asleep. Caffeine help matlab, does not let you fall asleep properly. Even excess of tea at night, one should always avoid coffee and tea.
All right. So, doctor, with that, I'll complete the food section and now come to issues which everybody of us is right now facing. The time that we sleep. Here's Alka Khanna's question, sir. I do not get sound sleep. How can I get that? And Mr. Anil Kumar, I have work tension and pressure, and all these coming. Acha, acha, all coming remind in sleeping time. So he cannot sleep. Basically, उनका work pressure उनकी sleep time को affect करता है. And we are working late night. We are a society which is moving to working in the nights. A lot of people are working in the nights and high pressure jobs. Does this have an impact on good quality sleep?
Definitely. As I already mentioned about the hormones, so the sleep hormones and the wake hormones, timing of sleep actually affects your personality in the long run. So my recommendation is most of my prescriptions they begin with sleep 10 p.m. to 6 a.m. Regular exercise followed by some kind of relaxation techniques like meditation or some breathing exercises. So what I usually tell my patients is obviously we all are practical, and if someone is working late night, he has to late night work late night. So accordingly, I say that you should know what is right so that you are able to practice as much as possible. So important is that you should get up in time, preferably around 6 o'clock or 7 o'clock in the morning. Go for exercise, be it brisk walk, jogging, running, swimming, cycling, aerobics, dance, playing any game, anything. Minimum 30 minutes of any kind of physical activity is very important. And as I already said, that needs to be followed by some kind of relaxation techniques. It definitely helps most of the patients a lot. Another important thing is that patients they tend to sleep in the daytime. So day is not meant to sleep. If you sleep in the daytime, you will definitely have difficulty in falling asleep at night. So try to get up at around 6 o'clock, 7 o'clock in the morning. Follow a healthy lifestyle and do not sleep in the daytime. Patients say कि नहीं रात में नींद नहीं आती है. So important thing is that they need to get up in time. If they make a cycle, if they make a routine, a good hygiene of getting up in
Right.
time, it gets normalized.
Wonderful. So there are people who are sleeping, but then they are disturbed by the slightest of the sound or light, and they are waking up and not able to sleep again. These are a lot of people who are asking similar questions. Mr. Dharani Kumar is asking this question. Just even a little bit sound, I'm not able to sleep. What does this
Some
mean?
are light sleepers, some are deep sleepers.
Yeah.
Actually, so it's a physiological thing. To address this thing, if it does not hamper their routine, if it's like once a while, once a week, once in 15 days, so then we just let it go. If it's like a daily phenomena and they're not able to fall asleep or there are frequent awakenings at night, then probably they need the help of some medications.
Okay. So, also understanding that people take medication for a long run, like my parents at home, my father takes sleep medication under supervision, definitely. But Vetri Raju is asking about similar question. I sleep only for 1 hour even after taking Zolfresh 100 mg. 100? I'm not sure it's 100. Something must be 10 or
Yeah,
15. Yeah. Yeah. So,
must be time.
so people do take these medications. I'm sure it's under supervision, but still they're finding themselves unable to sleep. Do these have a pattern, or do they have kind of adat si pad gayi kind of thing?
Most of the patients they have this phobia or this concept in their mind कि नींद की दवाई नहीं देनी है आदत पड़ जाएगी. So I usually tell them if a person has become a diabetic, if a person has become a hypertensive, they are on medications, and we are just controlling their vitals. So similarly, if you have difficulty in falling asleep, this is also a disease. So you need medications for it, and even if you have to take it lifetime, there is no harm. Proper thing is that you should have a good quality of sleep, and obviously you should be fine in the day. If with Zolfresh 10 mg he is not able to fall asleep, I think this needs to be addressed individually. What are the concerns why he is not able to fall asleep? So probably then some change in medications is required.
Okay, so yes, here's another alto procession. उनका नाम नहीं दिया, age and gender भी नहीं दिया है. I have central sleep apnea. Is there a cure? While I'm just falling asleep, my breathing stops. Then I get up and gasp and start breathing. It takes 3 hours for me to come back to normal. My heart area, stomach, and brain are in discomfort if the attack is severe. If it's not so bad, it happens. Not possible to sleep every time I try this. Yeah. So basically, sleep apnea is something which needs medical supervision and care immediately.
I'm
Yeah.
sorry for
शायद
this
आपका फिर से गया
problem.
है. That's okay. I understand.
Yeah.
We're
Am I audible?
living in the technical era. Yeah, you're audible. Yes.
Yeah. So sleep apnea is usually seen in slightly obese people It is a very, very, very common disease. So the classical symptoms are snoring. It has a crescendo, decrescendo pattern, and non-refreshing sleep and excessive daytime sleepiness. So these are the three symptoms of obstructive sleep apnea. Obstructive sleep apnea is actually people are not aware about it. Chronically, the chances of having heart attack, stroke, diabetes are almost to the tune of 2 to 5 fold in patients who have untreated obstructive sleep apnea. So, obstructive sleep apnea is a treatable disease. You need to undergo a sleep study that's known as polysomnography, and that gives us a lot of parameters. What is the saturation levels? How is the breathing pattern, or the limb movement? So, accordingly, we suggest CPAP, most commonly at times BiPAP, and the patient has to connect that the tight mask, and that machine, it sends the pressure with air and it keeps the lungs, which helps in proper oxygenation during the night. So once the brain and the body gets proper oxygen, the metabolism normalizes. By using CPAP regularly, almost 70% of patients, they tend to lose weight also.
Yeah, that's interesting. That's yes, I know a friend who carries the CPAP even if they are traveling abroad very religiously. They carry their machine because it's very important for him to. He's found the benefits of carrying the machine, and we all understand how important it is for him. Yeah.
And now the machines,
Here, yeah. Sorry,
now the
doctor. Please
machines,
continue.
machines are very handy. They weigh even less than a kg. And even at airports, also the security people, they know that CPAP.
Yes,
It's not a
yes.
problem.
Initially, it was a little difficult, but now, yes, the security and a lot of other people do understand that this is a medical help that they require. Interesting. So, doctor, there are two people who are asking about depression, man gaming, and Mandala Ganesh. Both of them are asking, sir, I'm suffering from depression. I need sleep. Please help me. And Mandala Ganesh, please help. I am suffering from depression. Yes. So, lack of sleep, does it lead to depression, anxiety, or lack of depression or anxiety? Is that going to lead to lack of sleep? Are they
It's both ways.
connected?
It's
Yeah.
both ways. So if you're depressed, it's very common that you don't tend to fall asleep. You don't have a comfortable sleep, and vice versa. If you're not having a comfortable sleep, eventually you develop some depressive symptoms. So, see, if you have depression, then I would very strongly recommend that without wasting, please consult a psychiatrist or a neurologist, because depression is treatable and the quality of life improves, and you're able to work properly, you can live properly, you can have a better life. So the quality of life is not good of patients who have depression, and it's still considered a taboo. But please consult a doctor as soon as possible so that your depression or insomnia is treatable.
खलील साहब, डार्क स्पॉट्स के बारे में हम यहाँ आज बात नहीं कर पाएंगे, बट डेफिनेटली अपोलो 247 में अदर स्पेशलिस्ट कैन डू टॉक अबाउट इट. Sorry for not able to take your question, Khalil साहब. Justin is asking, I'm suffering from hypothyroidism and other issues, lot of problems to it. Do these hormonal issues also have an impact on sleep, doctor?
Yeah, definitely. They do affect.
So how does
again,
hypo have an effect and hyper have an effect of thyroidism?
Hypothyroid, usually patients, they become slow, they are overweight, they are sleepy, the metabolism is low. Hyperthyroidism patients, they are overactive, they have tremors, and the metabolism rate is high. Sleep is less in hyperthyroid. Hypothyroid, although they tend to sleep more, but in case if they are obese, they have obstructive sleep apnea or any other underlying medical condition which prevents them from falling asleep properly, can have insomnia also.
Right. So underlying reason को treat करते हैं तो ये other side whatever experience करते हैं वो भी treat हो जाएंगे. That's what you mean to say, doctor. Yes. So asking one of my friends' question, which is also a registered user's question, This is about restless leg. She's been suffering for a very long time with restless leg syndrome. She's unable to have quality sleep, and in fact, she's also fearing that she'll not be able to sleep well, and she doesn't even sleep well. उसको डर लगता है सोने में. So what is restless leg syndrome, and how can we help her?
You very rightly said, patients, they remain fine in the daytime, but by the time evening begins, that phobia starts setting in, that they won't be able to sleep because of the restlessness in the legs. RLS is a very common disorder. Patients do have primary restless leg syndrome, or it may be associated with some other diseases commonly seen in Parkinsonian disorders. So, restless leg syndrome is any kind of abnormal sensation in the legs because of which there is an urge to move the legs. Until the time person is moving the legs or pressing the legs, they feel comfortable. As soon as they stop doing that activity, that abnormal sensation begins again. So this is the definition of restless leg syndrome. It does not need any investigation to diagnose. So it's a clinical diagnosis only. As far as the etiology or the causes are concerned, iron deficiency is one of the causes of restless leg syndrome. So the patients who come to us with RLS, we usually get their CBC, iron profile, ferritin levels done. If it is less, we try to treat it depending upon the levels. So preferred is IV iron supplementation nowadays. And it is seen that once the iron levels get corrected, most of the patients, they get relieved of RLS. But again, RLS is treatable. We have a lot of medicines to treat restless leg syndrome. So please don't have any phobia or scare. RLS is treatable. It's manageable.
And I will also have to mention Sheetal, my friend, who is just 45, 46. She thinks that she'll not be able to come out and talk about this issue because she finds herself that she's in a younger age group bracket who cannot have this kind of issue, and she should not be talking about it. She finds it tabooed.
Some patients do feel it, but RLS is usually seen in older age groups above more than 50, 60s, but it is not uncommon in younger age groups also. We have a lot of patients in 20s, 30s also who present to us with restless leg syndrome. So please tell your friend again that it's treatable. Do consult a neurologist. It's important.
Yes,
She'll have a good quality
thank
of
you.
life.
Yes. So, in fact, the moment I saw that you're going to come here on this show, I texted her immediately and says, "Please watch this show, and this is for you." So, I'm glad that you have given some hope that this is not just for seniors. This is also affecting younger people. Done.
Yeah.
Doctor, next
And-
question
and
is
it's treatable.
from.
Treatable. It's treatable. I'm repeating it again and again because patients they have
Yes, sir.
come with that state of mind, matlab, phobia, depression, all those things, stress, the fear of falling asleep, not going to the bed. So that's why I'm repeating it again and again. It's treatable.
It is. It is. Thank you so much for that assurance, Doctor. Dr. Uday Anumolu's question. I am 19-year-old. Suddenly, my pattern of sleep is disturbed since last year. I'm not able to sleep properly, even though I sleep full of dreams and disturbed sleep. How can I resolve this, sir?
Okay. So 19 years old, first thing we need to check that has he changed his place where probably he might be in the school, might be at his home till a year back. He might have joined some college. Maybe the place where he's sleeping is changed or not. That's the one thing. Second is the atmosphere where he is staying nowadays, his daily routine, whatever we do in the daytime, that affects a lot in the sleep.
Correct.
So if he's in a college or he's some other place where there is a lot of stress in the daytime, so all these things they actually affect the sleep. It needs to be addressed individually. But the problem that he is addressing,
Lifestyle plays an important role. You mean to say the lifestyle and social changes that are recent must have affected his sleep pattern?
yes. So this needs to be addressed individually, but it's treatable. He should be fine. You just need to consult individually.
Yes, sir. Uday, you should be fine. And then here's another similar questions. Mr. Venkatesh R is asking, sometimes when I get dreams, next day I feel exhausted and get a headache. Why does this happen only at times and not all dreams cause this problem? Have you seen such cases?
Yes, it's very common. So, um, as I mentioned in the beginning of the talk, REM sleep and REM sleep. So there are different types of parasomnias also. So sleep terror, these scary dreams, nightmares, these frightening dreams. Again, if it is like once a while, the patients just need assurance. If it is very frequent, then they need some kind of treatment. Good sleep hygiene, as I told, timing of sleep is important, regular exercise, some relaxation techniques. Everyone should practice it, and usually the quality of sleep improves significantly just by following a healthy routine. In case if
Okay.
still he's following a healthy routine, he still has this problem, he can definitely consult any neurologist, and this problem can easily be addressed with.
Done. Sai Surya Teja. Having dreams every day and I'm remembering them. Is this a good sleep or am I having some kind of disorder?
If the dreams are not disturbing you, then enjoy. If they are disturbing you, then
Kalam
obviously you
saab
need.
ko yaad karo. Dare to dream and care to achieve. No, but seriously, doctor, I've seen children who do sleepwalk and sleep talk and dream a lot in the sleep. Especially my daughter, while growing up, I did see her dreaming and talking about the dreams. So, is this a pattern? Can we help children, or does it also continue after they grow up?
See, these are parasomnias. So there are different types of parasomnia: sleepwalking, sleep talking, and sleep terrors, nightmares, as I just mentioned right now. So parasomnia, sleepwalking, sleep talking, it's more common in children. But the good thing is that it's not very frequent. It's like occasional. So we usually need to um, tell the parents that it's not going to disturb, and usually subsides on its own during adolescence or when the child reaches adulthood. It's a line around 5 to 7% is seen in children, and it's less than 1% in adults. But again,
Okay.
the episodes are very infrequent, which actually do not need any medicines to treat. They usually subside on their own.
Okay. Here's a
And
registered. Sorry, doctor, you're continuing something. Please continue.
in the other age group, the older age, there is a disorder known as RBD, REM sleep behavior disorder. So in RBD, there is dream enactment behavior. Patients, they actually start enacting what they are saying. They start shouting, they start speaking, they start hitting, or they might fall from the bed. So if RBD is there, then it definitely needs treatment. It needs medicines to, and
Okay.
again,
Okay.
it's treatable. Yeah.
So we need to understand where are we, and what is the pattern, and somebody in the family can help them because one will not understand what's going around with their
Yeah.
sleeping and
The
parasomnia. It's a family,
patient
immediate family.
patient never explains. It's usually the husband or the wife who's sleeping next to the patient, and many a times patients, they actually they are not aware, and when the partner tells them, so initially there's a denial mode. No, I never do like that. I never do it. So we need to tell the patients, yes, this is a disease
Yes.
and this happens. Patients don't know, and it's treatable.
Yes, doctor. Here's Mr. S.K. Panda's question, who is a registered user. Doctor has changed my medicine for diabetic neuropathy from gabapentin to pregabalin. I am facing withdrawal symptoms. I've been feeling restless and getting no sleep for the past 4 nights. So, what kind of help can we advise him, doctor?
See, gabapentin and pregabalin, both of them, they fall in the same group. Both are work on the GABA receptors. So, gabapen anti. He said gabapen anti or gabapen.
It's only gabapen here, which is written, doctor. I can't see
So,
NT here.
pregabalin is supposedly more efficacious than gabapentin, but if it is not suiting you, then probably you need to consult your doctor again.
Okay, so understanding the requirement, doctor, I think it's important to be aware of what's happening and then putting it to the doctor in the right time so that the doctor can give you professional advice. That's also important in such sleep issues, right, doctor?
Right.
Yes. Gabapin NT is what they have put up. Mr. S.K. Panda has typed. Gabapin NT use kar rahe the. Now it is pregabalin.
So, gabapentin, anti is not Ritalin and pregabalin. So, all of them they cause sedation. So, gabapentin anti would definitely be giving them a better sleep as compared to pregabalin. So, why the doctor has stopped nortriptyline, there has to be some reason. So, this he can always discuss with the doctor that he is having sleep-related issues.
All right. So, Dr. Navdeep Kumar can be consulted on Apollo 24/7 in case you require his advice. He is available on Apollo 24/7. He can be consulted, Mr. S.K. Kumar. All right. Next question. Doctor, here is Deepak, 39-year-old. It takes 2 hours for me to go to bed at 11 p.m. and my sleep breaks at 4 or 5 a.m. every day. After that, I don't get any sleep. Same thing, there's yet another registered user, male. I'm unable to sleep till 2 a.m. in the night. I try sleeping earlier, but I have a restless mind that remains active till 2 a.m. even though I go to bed early. So what is this that they are unable to lie down and not getting sleep? मैं तो बस ऐसे पिलो नेक पे छूती हूँ तो people keep calling me कि तू you're not with us. I don't
You're blessed.
understand.
You're blessed, Madam Lakshmi. Yes.
I'm
Patients.
blessed, exactly.
So, see, there are a few things that everyone should follow, those especially those who have difficulty in falling asleep. First is that they should not use any kind of gadgets after 9 p.m. Number two, the room in which you are sleeping, preferably if there's blue colored light, rather than red or white. Blue helps in having proper sleep. So, if you're not able to fall asleep, you go to your bed, anxiety, thoughts, stress keeps on disturbing you. So, what we recommend is you leave your bed, you go to some other room, preferably start studying something, maybe a novel or some article. So, once you are studying, usually you tend to fall asleep, and जैसे ही नींद आने लगती है, you just go to the bed, try to sleep, and you patients might have to repeat this phenomenon 2 3 times, but once you are persistent in it, so usually this is a good remedy. Another thing is important is to get up in time around 6 o'clock in the morning. So once you start getting up at 6 o'clock in the morning, you're doing some kind of regular exercise, you're not sleeping in the daytime. Most of the times this
Yeah.
problem gets yeah.
Yes. And how about people like Anand Kumar Sharma? Sir, I have to work for long hours and often work late in the night, and I'm not getting sleep immediately even after I finish my work. So now as a generation who has to work late in the night and night shift भी होता है, तो इनको कैसे help करें हम? जिनको day mandatory सोना होता है, is that sleep as equal, as good enough as the night sleep?
See, this thing needs to be addressed individually. Some there are like lakhs of people who are working at night, but every one of them is not having sleep-related issues. So, if it is actually disturbing them to a significant extent that they are not able to do their best professionally or socially or personal life, then definitely they need to change their job. Many a times, patients they have an option of changing the shift. So when a doctor writes that you need to sleep from this time to this time, most of the times the companies they do consider changing the shift. But if there's no other option, then they need to have some medications. Daytime sleep is definitely not as good as nighttime sleep. So if you're not falling asleep, then as I mentioned earlier, also irritability, frustration, restlessness, clouding. So these are the common symptoms that the patients they suffer from.
Okay, okay. Here's Mr. Viksit Jain's question. I'm on an anti-epileptic medications. I'm 25-year-old male. What are the desired hours of quality of sleep during this medication? And I also saw somebody else asking about anti-epileptic medication that they're on, and what is the time that one can sleep.
See, sleep deprivation is a very important trigger of epilepsy. So, It's very, very, very important for epileptic patients to have a comfortable sleep at night. Be it any disease or be a healthy person, the timing of sleep remains the same for everyone. So, for epileptic patients, they are not supposed to miss even a single dose of their anti-epileptic medicine. And ideal sleep timing is from 10 p.m. to 11 p.m. till 6 o'clock in the morning. So, proper sleep is a must, 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 must for epileptic patients. It's
Right.
because
So,
some
so
patients they have they have aura.
इतना stress
They tend,
है तो I can understand how important it must be.
yeah. Because the problem is in epileptic patients, those who do not have aura. Aura is the sensation that patients they get to know that they are about to have a seizure. So patients who do have an aura, they are still safe. Probably that they can position them in a safer place. And patients who don't have an aura, well, suddenly comes and you become
Yeah.
unconscious. It can be life threatening also. So well, it's very important. Sleep for epileptic patients is like must, must, must. Proper sleep and time.
Yeah. Right. Mr. Lazy Techie, नाम, gender, age, कुछ नहीं है यहाँ पर मेरे पास details बाकी नहीं है. I have narcolepsy systems. Which treatment is required for this?
Narcolepsy is a rare disease in which there are sudden sleep episodes during the daytime while person is walking, working. Suddenly they fall asleep, and there are some other symptoms also in narcolepsy. Narcolepsy now is treatable, but again, as I said, on this platform, it's not possible to discuss. We need to address each and every patient individually. So
I
it's
totally
better you
understand
consult
that.
a neurologist. Yeah. Again, I would say narcolepsy is treatable. So do consult a neurologist and start your treatment.
Yes. So lazy techie ji, I think you should, whatever your name is and whichever gender you are, you should consult, and there are treatment options which are again very individual related to. So please go ahead and consult. So I'm also receiving a lot of questions here. Mr. Senthilvale is asking how many hours should a 60-year-old, 60 plus year older sleep and a 10-year plus should sleep. Also, there are people who are asking Mr. S.C. Jain, male 80 hair, not able to sleep more than 6 hours in the night. And there are younger children who are asking, I'm not able to sleep well. So, is there age specific sleep duration and quality?
Yeah. As I mentioned earlier also, when a child is born, the child remains sleepy the whole day. It's around 20-22 hours they sleep. As we grow old, the number of hours that are required for a person to have a comfortable sleep, they tend to reduce with age. So if a person is sleeping almost 8 to 9 hours in their 20s, probably even 6 hours is good for them after 60s. Important thing is that if you have a refreshing sleep, be it 6 hours, be it 7 hours, then it's adequate for you. You are active in the daytime, you don't fall sleepy during the daytime, and you sleep well, be it 6 hours or 9 hours, it's okay for you.
Right. So, understanding that each one has a different age group and then symptomatic or requirement based, alag alag hai. Somebody is asking about grandmother, somebody is asking about mother, parents, and we are concerned about it. So while I'm looking at questions, long-term medical, you have answered this question, but I would want you to again talk about it. Long-term, अगर हम sleep medication लेते हैं तो उनके side effects होते हैं क्या? And somebody else is also asking about, Doctor, I've been using sleeping pills for quite a while. Addictive होते हैं क्या?
See, as far as our medicine is concerned, every medicine has got side effects. We need to choose which medicine to be given, to whom it needs to be given, what all medications the patient is already on, is there any drug interaction. And even if a person has to take a medicine to sleep for the whole life, there is no harm, please take it. But it has to be under supervision of a doctor. Medicines are there to give us relief. So, a very common, very common issue nowadays is that patients they check the side effects of the medicines online and then they don't take the medicines. So then it actually becomes difficult for us to convince the patient because till the time they don't know So look, it's easy. So once you see that there's a huge list of side effects of all the medications, which actually are not seen in clinical practice, which actually doesn't happen. So, but they are mentioned in the literature. So patients they look about the side effects of the medicines, what this medicine is doing, then they usually don't take the medicines. But this is a very wrong practice. You have any queries, discuss with the doctor and just follow the doctor's advice genuinely, religiously.
Done. Doctor, here's another question. Sai Srijan, I think Sai Srijan's grandmother's question we did ask. I'm sorry. Yes, box 1101. Naam gender यहाँ नहीं है. Get up once or twice at the night to urinate. Should I drink less water or am I looking at developing a prostate problem? Anurag, male 50. This definitely disturbs his sleep. Okay,
Right.
नाम यहाँ कर दिया है.
Okay. So we usually recommend that one should avoid liquids after 7 p.m. As I mentioned earlier, also the ideal time of having dinner is around 8 o'clock. So it's around 7 p.m. to 8 p.m. The patients who have frequent urination at night, it's usually seen in patients who have prostate-related issues or other bladder-related concerns. So we usually tell them that avoid liquids after 7 p.m. If you're on any medications, you can have the medicines after dinner with maybe half a glass of water or bare minimum what is required to take the medicines. Till 7 o'clock in the daytime, you can have as much as liquid you want to have, but after that, if you restrict the liquid intake, obviously there will be less of urination, and that will definitely help you in reducing the nocturia. Uh,
Done. So, Dr. Another registered users question. Shyamla is asking about husband who was diabetic and amputation किया गया है उनका and painkillers and initial treatment में काफी सारा pain था. While managing the pain, he suffered from sleepless nights and he still is unable to sleep. In such conditions, especially surgery-related conditions or any other physical disorders, is sleep disturbance normal and how do we treat this?
It's very common. It's very, very common, especially in neuropathy, diabetes. So his neuropathy must be extensive that he had to undergo amputation. So even after amputation, there is phantom pain. We call it the patient still feel the pain is there, even if the limb is not
Yes.
there. So we do have medications to control the pain, and we just need to dissect all the medicines that the patient is on. And he's
इनका 3
diabetic.
महीने हो गया है. They're 3 months cross हो चुके हैं amputation के.
So again, it depends. We need to see the drug history, what all medications he's on. But definitely, we do have a lot of medicines now to provide a good quality of sleep and to relieve pain. Now we have patches, injections, pumps, so many things are there. So we can definitely help them.
Okay. Yet another registered user's question, Mr. Abhishek Mukul Tiwari, 49-year-old male hai. I have left alcohol some time back. Even after that, I'm experiencing sleeplessness. Kindly help. Yes, this is a very, very important topic that we are entering into. Alcohol or any other substances, sleeplessness, while we think that we are able to, this is calming down, but I'm sure that there will be any correlation between anxiety relief and then sleeplessness and substance.
Yeah, it's a very, very valid topic. Alcohol is, look, it's written in our textbooks that in moderation it is good for the health, almost 50 to 60 ml if a person is taking. So that helps in improving the metabolism, it allays your anxiety, and it helps in giving you a restful sleep. It doesn't mean that I am endorsing alcohol. It's just what is mentioned in the text I'm telling it. So any kind of substance, well, we don't recommend any kind of substance use. Most of the cases, they usually improve just by following a healthy lifestyle. If you have left alcohol, it's a great achievement of your life. Do not start it again ever. But again, as I mentioned, please try to sleep in time, even if you have difficulty in falling asleep. Start getting up at around 6 o'clock in the morning if you're routine allows you, if your work profession allows you, start getting up around 6 o'clock. Do some kind of physical activity for at least half an hour, and that needs to be followed by some kind of relaxation techniques. Just follow this thing. Do not sleep in the daytime. I'm quite confident that this should definitely help you.
Done. Mr. Pranav Srivastava is asking, is it safe to take gabapentin for years? I'm taking it for idiopathic RLS, restless leg syndrome.
Very safe. Can go ahead. Not to worry.
Not to worry. Wonderful.
Not to-
All right. Here's Mr. K. Ram's question. On few days, I'm unable to sleep even for a minute. Despite trying my best, I listen to music, soft music, consuming warm milk, counting 1, 2, 3. Believe me or not, not even a minute of sleep whole night. Why does this happen?
Might be suffering from any medical illness, might be having some other anxiety or depression related issues. If you are not able to fall asleep at night, please stay awake during the daytime. Do not sleep in the daytime. So, if you try to keep yourself awake in the daytime and follow a healthy lifestyle, definitely this problem will get addressed to a large extent.
Ramji, I would say that you have come to the right platform, right expert here, because if you have identified that you are unable to sleep even for a minute, and if you have not reached out for a medical help, this is the time that you should reach out. Do consult a neurologist, as Dr. Navdeep Kumar ji has mentioned in the beginning. We don't even know who to go and consult. So a neurologist is a person that you could go ahead, and Dr. Navdeep is available on Apollo 24/7 if you wish to consult him. And one question that is a lot of people are asking is about how to sleep even if there is a lot of disturbance and noise at night. Amit Mente is asking this question.
Again, it depends. Like, you need to try to avoid as much as possible, preferably more airproof door, windows. And again, if nothing is working, there's no harm in taking a medicine, or if you can change your place where you are staying. So, well, these are the things that you need to do.
Done. So one last question I'll take from audience and then wrap this up because we're running short of time here. Miss Piyush was asking, hello doctor, what is your take on sleep supplements like melatonin, which are marketed to provide better sleep? Do you recommend taking them, or should we consult a doctor prior to taking them?
See, melatonin is not a supplement, it is a medicine. So, no medicine should be taken without supervision.
So ये जो ओवर द काउंटर मेल्टोनिन के स्ट्रिप्स मिलते हैं या मेल्टोनिन ऑनलाइन प्लेटफॉर्म्स में भी आजकल सप्लीमेंट्स के नाम पे गुड स्लीप, रेस्टफुल स्लीप के नाम पे कॉम्बिनेशंस जो मिलते हैं, so one should be wary of them.
Nothing to be taken without medical supervision, without medical advice.
तो इनके भी साइड इफेक्ट्स होते होंगे जो हम गूगल डॉक्टर्स जो है यहाँ पर जो डॉक्टर प्रिस्क्राइब करते हैं उनके तो हम 1000 गूगल साइड इफेक्ट्स निकालते हैं, तो ऐसे सप्लीमेंट्स के भी निकालने पड़ेंगे.
One should not take anything without medical supervision. It's your body. Please love yourself and do not get driven by the social media or the advertisements or the forwards that we get on WhatsApp or other social platforms. You have any problem, please consult a doctor and just follow his or her advice.
That's it. Wonderful. Thanks, Piyush, for asking that question. Yes, because it is important. जो sleep and good sleep के नाम पे marketing चलता है, वो जरा wary रहिएगा. Thank you, Dr. Navdeep. And I think towards the end of this show, I would want you to give us some good tips to have a good sleep.
Thank you, Madam Lakshmi. As I already mentioned, the timing of sleep is very important. One should try to sleep between 10 p.m. to 11 p.m. and should get up at around 6 o'clock. Healthy lifestyle, regular exercise, be it in the form of a brisk walk, jogging, running, swimming, cycling, aerobics, dance, playing any game, gym, whatever you enjoy, please do any kind of regular physical activity, and that needs to be followed by some kind of relaxation techniques, be it meditation or some breathing exercises. Do not sleep in the daytime. Even if you have difficulty in falling asleep at night, get up early in the morning, follow a healthy routine, avoid sleeping in the daytime, and if you follow this pattern, within few days you'll realize that you will start having a comfortable sleep. That's it.
That's it. Thank you. Thank you. Thank you so much, Doctor. It was a very informative Sunday, I should say. This morning, we're more recharged to sleep better in the night. We appreciate your time this Sunday morning. Thank you, Dr. Navdeep.
Thank you so much, Madam Lakshmi. Thank you so much. Thank you for the 24/7.
Thank you. And I thank the audience for being such interactive and informative questions, because your question is answer to many. Now I'm going to ask you questions. 3 questions coming up. Health quiz mein main puchne wali hu 3 questions. Please type your answers over YouTube chat. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team only. And please do type in the YouTube chat box only if you want to participate in the quiz. And then once, if I take your name to be the winner, do write your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. Chaliye, aaj ka quiz, health quiz on the screen. And your question number 1 is, true or false? Exercise helps you sleep better. True or false? Question number 2, yes or no में type कीजिए. Is clinical insomnia a mental illness? Is clinical insomnia a mental illness? Yes or no? Question number 3. How much is the least expensive Apollo 24/7 Circle membership worth? What is the price? Simple question hai. How much is the least expensive Apollo 24/7 Circle membership worth? क्या प्राइस है उसका? आप सर्कल मेंबरशिप मिनिमम वैल्यू में कितने में पा सकते हैं? क्वेश्चंस के आंसर्स आप यूट्यूब पे टाइप कीजिए. एंड व्हाइल आई एम वेटिंग फॉर द आंसर्स and the winners while the team decides, let me tell you, if you have downloaded Apollo 24/7, if you have used it, you will understand it is giving you as such benefits milte hain, but I'm going to give you certain coupons which aapke benefits zyada badh jayenge. You will get flat 150 rupees off on first online doctor consultation. The code that you can use is first VC. Doctor consultations direct from Apollo 24/7 app पे आप first VC code use कीजिए and get flat 150% off on first online doctor consultation. And here's yet another coupon that we're giving away. Coupon code is first3. Apollo 24/7 app पे आप order medicines direct from Apollo, flat 25% off on online medicine orders honge. So use this code first3 and get the 25% off on your online medicine orders. And well, also we are giving you an exclusive code only for Health Hour viewers, and this code is HH247. Health Hour viewers can utilize. You can get 199 rupees off on online consultation with Apollo doctors. This is HH247, and also 20% off on medicine orders. This is really interesting because in addition to the coupons, this is a benefit exclusively for the Health Hour viewers for joining us on this Sunday morning and asking your questions here. Well, please do take care. Such interesting and valid tips that Dr. Navdeep has shared today. We thank him and thank you for your participation as well. While I am looking out for 49, 199. Well, देखते हैं कौन सा किसका राइट आंसर हो सकता है. True, no, yes. A lot of them, Praful, Saxena, Rakshak, a lot of you have been doing, and I am giving you the winners' names right now. The winners are Dharani Kumar K, Dharani Kumar, Ayansh Chabra, and I'm waiting for the third winner as well. Let me see, and Mr. Balakrishna M. I repeat the winners' names: Dharani Kumar, Ayansh Chabra, and Mr. Balakrishna M. RN or N. Yes, that is it. Congratulations, winners. Please write back to claim your gift vouchers from us. You have to write back to marketing@apollo247.com to claim your gift vouchers from Apollo 24/7. All right, next week we are coming up with an interesting topic, huh? Let's discuss about this. Monsoon dairies, steering clear of diseases. क्योंकि बारिश होती है, if you are experiencing rain and then इतना सारा बारिश है, we are prone to diseases. So steering clear of monsoon diseases. Next Sunday, 24th July, 11 a.m. If you don't want to miss this session, do subscribe Apollo 24/7 YouTube channel and follow us on social media. And also there's a bell icon out there do turn your notifications on so that you don't miss any other good session. Okay, thank you so much, all of you. This was an interesting Sunday. So sleep well, take care of yourself. Namaskar.